We have a very interesting talk planned for you today. I've got with me Ruby Tischoff, whom I've known for more than a decade. We both had the same mentor, Dr. Isaac Elias. Now, Ruby has decades of experience in the coming together of nutraceutical science with integrative medicine. And so her talk today is going to be on Galectin-3. She is the director of education at EcoNugenics, and she's been involved with EcoNugenics and with Dr. Elias's work prior related to EcoNugenics and been involved in the research. So she just has so much information. We've got a great talk planned. So we're going to be talking about Galectin-3, which is a molecule that not enough people know about. It has huge impacts in our body, though. So, Ruby, I'll let you take it from here. Tell them about what Galectin-3 is.
Thank you so much, Nafysa, and it's so great to see you. Yeah, if you don't mind, I'm going to share my screen. I have some slides to share, and we'll just keep this as a discussion so people can ask questions during the presentation. And I'm just really excited to share this information. It's a fascinating field of research that is really taking off now. Can you see the slide, the first slide that I had pulled up? Great. Okay, and I'm just going to jump right in here. So Galectin-3, what exactly is it? Maybe some of you have heard about it by now. There are over 8,000 published studies on it, and the research really started taking off around 2009, 2010. And in 2011, it became recognized as an FDA-approved biomarker for heart failure. Essentially, it's a master alarm protein that responds when the body is under stress, when there's an infection, when there's injury or trauma. Galectin-3 gets released first, and it's released by many different cells, primarily in the immune system. But even tumor cells can secrete Galectin-3. And the goal is for it to really drive that inflammatory repair process. So it activates the initial response, the immune response to, say, for example, an acute infection. It instigates the recruitment and infiltration of immune cells to the site, and initiates what we would think of as a healthy inflammation response to repair the body.
Ruby, I
But
would interrupt you for 1 second. So you said that tumor cells secrete it, but what other cells secrete for the patients who don't have cancer, but they have, say, long COVID or
sure,
Lyme?
yeah,
Yeah.
it's primarily secreted by immune cells, so macrophages, and it's also secreted by activated microglia in the brain when there's inflammation. So it's secreted by many different cells, but it's primarily an immune cell that is then driving the cytokine cascade. So it sits at the headwaters of the cytokine storm and activates first, and then a few minutes later, all the downstream cytokines are activated from that initial Galectin-3 activation. So Galectin-3 only needs to go up a little bit in the body, usually within just immediately after there's a stress or an injury. And then the rest of the cytokines will activate several minutes later downstream, and they'll go up much, much higher than the actual Galectin-3 going up. So Galectin-3 levels don't necessarily need to change very much for there to be a huge amount of downstream inflammation. And so what happens in today's world is that we're all faced with these inflammatory stressors, from toxins to immune, activation agents, trauma, stress, you name it. Our Galectin-3 levels are remaining high. They also go up just naturally with age. So as we get older and there's just more stress and inflammation in the body, those Galectin-3 levels are also going up as we age. And there's long-term data studying people who have lived to the age of 100 or beyond. They have lower Galectin-3 levels than their cohorts who were measuring at high levels in their 60s and 70s and did not live as long. So it's studied in a lot of different populations and is recognized now as a biomarker in also certain cancers, suggested as a biomarker in kidney failure and kidney disease. And the data continues to show its involvement in pretty much every chronic and acute inflammatory condition that we're facing today. And it fuels immune dysregulation. It can allow pathogens and tumor cells to hide and sequester from the immune system. It's involved in inflammation and the process of inflammation turning into fibrosis, so scar tissue, hardening of the organs and tissues in the body, in the joints, throughout the body. It fuels cancer growth and metastasis. And it's also involved in biofilm formation. It allows pathogens to adhere to the intestines in cytokine storm. It's involved in sepsis. There's research in COVID with it, COVID severity. They're using it as a biomarker to predict COVID severity upon admission to the hospital. They can predict based on the Galectin-3 levels who will be ending up in the ICU, for example. So it's being proposed as a biomarker for so many different areas in addition to heart disease and as well as cancer. So it's a very important molecule to pay attention to. And the research just continues. If people are wondering if Galectin-3 is involved in any condition that they may be struggling with or seeking solutions for, you're likely to find a study in the literature showing Galectin-3, high Galectin-3 as driving or as being, a prime player in that condition.
Thank you, Ruby. You just brought up so many important pieces of information about Galectin-3's role in the creation of inflammation and then the creation of complex chronic illness. I heard you talk a little bit about biofilms. Can you tell us a little bit more about this? How does Galectin-3 aid in the creation of biofilm?
Absolutely. So it allows to form these pentamer-like formations in the body that bind with other ligands and other glycoproteins and other compounds in the body to form these lattice formations that create this fibrotic structure in the body. They create hyperviscous structures. They create these microenvironments that shield, say, for example, the tumor microenvironment or areas of infection. They allow the pathogens to adhere. The Galectin-3 formations allow the pathogens to adhere to, say, for example, the lining of the intestines to then continue to add on more ligands and more proteins, glycoproteins, and other substances to build these shields around these areas of infection or injury in the body, essentially.
So the Galectin-3 will actually stick on to the carbohydrate-rich and protein-rich matrix that the microbes themselves create. Is that true? And just kind of become one with the biofilm?
Essentially,
Yeah.
yes. And so the Galectin-3 molecule, I'll show you here on this slide, it forms, this is a single Galectin-3 molecule, and then they stick together and form these pentamers. And this is basically the backbone of the lattice formations, of the biofilm formations, of these hyperviscous structures in the body that essentially, create a lack of movement, a lack of communication between cells, a lack of circulation, and create these microenvironments, these pockets in the body that really just tend to fester and continue to produce inflammation.
Thank you. And now you didn't mention Herxheimer reactions just now, but I know that Galectin-3 takes part in initiating a Herxheimer reaction. Can you talk about that?
Yeah, so when there's a Herxheimer reaction, there's some die-off from these microbes, for example, or pathogens, and they release these endotoxins, and that spurs Galectin-3 to go up and then fueling the cytokine storm. So it's spurring this inflammatory reaction just by way of interacting with those endotoxins. And then the Galectin-3 will also bind to those lipopolysaccharides and kind of let them adhere to these, tissues and just really fueling that whole formation and that milieu, if you will.
Right. So it's really at the tip of the spear of the inflammatory cascade,
Absolutely.
right?
Absolutely.
Right.
Yep.
Yeah. Now, a lot of our patients struggle with mast cell activation syndrome. I don't even think I need to explain what it is. Everybody here knows. If anybody has a question about what that is, put it in the box and we'll be sure to answer it. But Ruby, if you can tell them about how Galectin-3 is involved with mast cell activation syndrome, please.
Yeah, so Galectin-3 can actually activate mast cells and trigger mast cells to release histamine. It's part of the inflammatory immune response. And so in that regard, it can fuel mast cell activation syndrome. But one of the things to watch out for is because it's also forming biofilms, that when you start to break up Galectin-3 with specific compounds, and we'll talk about that later, you want to be really careful with mast cell activation because of the sensitivity around releasing any sort of additional toxins. And since you are potentially breaking up a bit of that biofilm, it's as a gentle biofilm disruptor, when you start to use anti-galectin-3 agents, they can gently break up the biofilm, but for mast cell patients, that can be a little bit too triggering. So sometimes we've heard of practitioners treating mast cell to just go very, very slowly with these therapies that work against galectin-3 and just really use them in small, small doses at first.
Yeah, that's what
Yeah,
I've had to do.
galectin-3 is
Yeah.
shown to be involved at the root of mast cell activation, among other things.
Yeah, usually with my patients, who have mast cell activation syndrome, I'm just giving them baby doses of the galectin-3 blockers, but first I'm treat the mast cell usually. But um, you mentioned histamine and mast cells. Does galectin-3 initiate only histamine, or would you say that it initiates degranulation of the mast cell and we can get the thousand?
That's a good question. I would have to look more into the literature around how galectin-3 actually activates and what is going on with the degranulation of the mast cells. I imagine that there is a closer, deeper look into that. So I'd have to get back to you on that one and give you the accurate information. But
Thank you.
it is shown to activate and release histamine from mast cells, among many other immune triggers.
Mhm. Can you tell us about testing and the downfalls of testing for galectin-3?
Yeah, let me go back to this previous slide. So galectin-3 testing is available and it can be done pretty inexpensively through LabCorp, Quest, and other labs. And as I mentioned, it's a biomarker for heart failure. But the galectin-3 tests that we're getting from LabCorp and from these other labs, and remember, we're looking at, when we go through LabCorp, for example, in these big mega labs, their bell curves are much broader, so they're looking at a much broader range of the population versus what we would look at in functional medicine, which is a more narrow range of what's considered healthy or optimal. But the galectin-3 test, for example, does not differentiate between one of these galectin-3 molecules and a five-sided galectin-3 pentamer where they're stuck together. So the test could be up to 5 times lower than what levels you actually have in your body if it's measuring a lot of these pentamers and only giving one value instead of a value of 5. So it doesn't differentiate there. It also doesn't differentiate the test, doesn't tell between bound galectin-3 that is inactivated, not causing problems, not signaling, and free galectin-3 that is active, that is causing problems. So it's not going to differentiate if you're taking a galectin-3 binder, which again we'll talk about. It's not going to tell you that that galectin-3 is bound up and ready to be excreted, not causing problems. So it can still give a little bit of a skewed result that way. And then the main thing to look out for is that galectin-3 is often sequestered in the tissues in these areas of these microenvironments, of biofilm formation, of cancer microenvironments, where those levels aren't going to be circulating in the blood, so they're not going to show up as high. So for example, a lot of times breast cancer patients may show up with even abnormally low levels of galectin-3, yet in the tissue around their tumor, those levels could be extraordinarily high. So it's something to consider. But what you can use the test for, and Dr. Elias speaks about this in his work and in his writings, is he'll use the test as kind of a baseline. So especially with cancer patients, to measure how they're doing. If the levels go up, they know that the cancer is more aggressive and more active. It can be kind of an early biomarker there. Or if somebody seems to be healthy but has a very high level of galectin-3, over 20 or so, that would be a red flag to investigate further because we know there's inflammation going on somewhere in the body, so doing deeper testing there.
Thank you. So you're saying that testing is worthwhile doing just to get a sense of if it's high, but fully knowing that it's probably going to be significantly higher, maybe even 5 times higher due to the pentamer structure of the galectin-3, and the lab's not measuring that, right?
Exactly.
Yeah.
But what people will see is that their galectin-3 levels will go down over time if they're addressing it with healthy inflammation, methods and ways to address galectin-3. Again, like I said, we'll talk about over time, those levels should begin to go down and recalibrate.
Now, the spike protein on COVID has a similar shape to galectin-3. What are your thoughts on this?
Fascinating. So there is research showing that the galectin-3 N-terminal, this area, is nearly identical to the COVID spike protein. And so what they're suggesting in these publications is that by addressing galectin-3 with galectin-3 blockers, you may also be able to address the spike protein. So not only bringing down that inflammatory cytokine cascade, but also potentially addressing viral entry into cells and all the other damage caused by the spike protein.
Ruby, we can bind galectin-3, correct, with PectaSol?
Correct. So
Right.
PectaSol, modified citrus pectin, we'll talk about in a little bit, is a researched and the most researched and commercially available galectin-3 inhibitor.
Where
And it
I'm
is
going
shown.
with this, though, in my mind is, do you believe that we can bind the spike protein with PectaSol if they're in similar in shape as Dr. Elias talked about this?
We have some preliminary anecdotal reports that it can be very helpful regardless of what stage you're in, whether you're in, prophylactic stage, whether you're in a post stage, long-term, long haulers, that binding galectin-3 with the clinically research modified citrus pectin, the PectaSol, can help to support in different areas.
Okay, thank you.
Absolutely. So one of the things that I wanted to touch on for the purpose of this conversation is the research showing galectin-3's involvement in environmental illness, in sick building syndrome, in heavy metal toxicity. So as we said, it's the upstream pilot light for uncontrolled inflammation, for cytokine storm, mast cell activation. So it's really a trigger for these debilitating, we say in this slide, mycotoxin symptoms, but it's not limited to mycotoxin. It's kind of whatever you're reacting to in your environment, whether it's pollution, heavy metals, mycotoxins, whatever the trigger or triggers may be, galectin-3 is driving that uncontrolled immune response, that inflammatory response that brings on all those symptoms. So it's also allowing pathogens to evade the immune system. So it's forming the backbone of biofilms in that way as well. But they've shown that patients with mycotoxin illness, with sick building syndrome, damp building syndrome, and black mold exposure have higher galectin-3 levels. They've also shown higher galectin-3 levels in people with heavy metal body burden, especially I believe cadmium is one that they've studied a lot. So it goes to show that when we're exposed to these toxins, galectin-3 is going up and driving these symptoms that are creating these environmental sensitivities, and people, are restricted in their travel, in their, day-to-day lives because they're so highly reactive based on these elevated galectin-3 levels. Now, when we block galectin-3 and address it, people with really high sensitivity, environmental sensitivities, find that they're able to enter into perhaps a less than ideal environment, or go and be exposed to maybe some mold or some other toxins or triggers that would have previously sent them into bed for weeks. And you know the story. Well, now their reactivity is much, much, much reduced. And of course, we emphasize that the environment is key, and you don't want to be living in an unhealthy environment or exposing yourself repeatedly. That's just very counterproductive and counterintuitive, but sometimes we can't help it, right? Sometimes we have to travel, or we are just exposed unknowingly. So by addressing the galectin-3, it's not only helping to bring down that inflammatory immune reaction, but there are other benefits as well in terms of reducing toxin load in the body, and we'll talk about that.
Thank you.
Absolutely. So yeah, I think that's kind of it for the slides on galectin-3. I do have some additional slides that I can share later, but I wanted to see, oh, here we go with chronic illness. Can you still see my screen?
I don't see what you've shared if you're trying to share anything.
Let me just, one sec, sorry about that. Here we go. Just one more slide here on the various sort of downstream effects with galectin-3. Some of you have probably heard of the biomarker MMP-9. That's getting a lot of attention now in like mold and Lyme and mycotoxin illness, but it drives the blood-brain barrier disruption. It's linked to leaky brain, to leaky gut, and really this redistribution of toxins kind of, throughout the body. So galectin-3, high galectin-3 drives that MMP-9 activation. We talked about the cytokine storm implicated in COVID severity. We talked about mast cell activation, histamine release, allergic inflammation, asthma and airway inflammation, autoimmunity, tons of research in these areas with galectin-3's involvement. And then with neuroinflammation and neurodegenerative conditions, a lot of data there as well. So I'm going to stop sharing and see if, anybody has any questions about the Galectin-3 research. There's so much to talk about with this one specific molecule. So yeah, I could talk all day.
Dr. Parpia, do you have any other questions, or can I jump into a couple of them here?
Go right for it.
Okay. Who discovered Galectin-3 and when was it discovered?
That's a great question. I don't know who exactly discovered it, but they knew even as early as I believe like the mid 90s or even before of its involvement in cancer. They knew that it supported angiogenesis, which is the blood vessel formation to feed the tumors. They knew that it was involved in metastasis and the migration of tumor cells throughout the body, and they were calling it the guardian of the tumor microenvironment. This was early on, and this is where I learned about Galectin-3 with Dr. Elias in his clinic, and he was focusing mainly on cancer. And he would say, they knew it was involved in cancer, so he was giving, his modified citrus pectin, and he would say, my patient's pain is going away. Nafysa, maybe you remember this. He would say, my patient's pain is going away, but it's happening so fast. Maybe it's the heavy metals because it's removing heavy metals too, because we knew that about modified citrus pectin at the time. But then he would say, it's too fast. It doesn't make sense. And we just didn't know at that time, this was the early 2000s, that Galectin-3 was sitting at the headwaters of inflammation and fibrosis and, organ failure, joint destruction, all of that. So now we know, and the research is really just taking off. I mean, they say there's like one study every couple of days, a new Galectin-3 study coming out, a fairly robust one. So I don't have the information of who exactly discovered. I can do some digging and get back to you guys on that.
Yeah, I was curious. So, okay, we'll do just a couple more questions because I want to get to everybody wants to know now what do we do with this? Is Galectin-3 involved in angiosarcoma?
I believe there is some strong data there. Yeah, there's a lot of data in sarcomas and different cancers like that. Yes.
And is it a meaningful marker for pulmonary fibrosis? And then I know that you said the tests aren't great. People are asking about which specific tests.
Well, that's a good question. So the one Galectin-3 blood test is available through LabCorp, through Quest and some other labs now. It's fairly inexpensive. And as far as being an established biomarker for pulmonary fibrosis, I don't think that they have those levels and have that, fixed yet. But there's a lot of data showing Galectin-3's involvement in pulmonary fibrosis.
And then the lab test in terms of what is the level? Did you say 20 or lower?
So the levels are debatable because, as I said, it's kind of a difference in what we see a lot in functional medicine versus regular allopathic medicine. And Nafysa, Dr. Parpia, I'm sure can speak, a long time to this, but the levels, the bell curves are typically what's considered healthy is typically on the lower level and in terms of the LabCorp results versus considered healthy in functional medicine would be even lower than a 12.5. So I think 12.5 is around the normal range that you would get as a LabCorp normal, but ideally levels should be a little below that. So that's just as an example. Now, certain cancers and things, they may see extremely high levels, like above 20, 25. So that's something to definitely watch out for.
Great. Okay. We're going to pause on the questions so you can keep on going. All right, Dr. Parpia and Ruby, take it away.
All right, Ruby, let's go on with your next set of slides, which I think are going to be on PectaSol itself.
Yeah. Let me just pull these up and we'll talk about some of the research on PectaSol, which is the most researched and only commercially available Galectin-3 inhibitor. And just to give a sense, really quick, diving in to the development of Galectin-3 inhibitors right now, there are some pharmaceutical companies that are racing to develop some synthetic drug Galectin-3 inhibitors in various conditions, one being Alzheimer's. And I was speaking with a doctor who's involved with a family member in an Alzheimer's study where they're using one of these Galectin-3 IVs, these drugs that are in development. It's a one month supply for one IV. That's a 1 month dose. And that's costing the patient to be involved in the study $8,000 per dose right now. They are showing some benefits. It's very exciting. But again, this is, we're talking about synthetic drugs that are being developed to inhibit galectin-3, where that are at an exorbitant cost to the patient, where we're looking at something that is naturally based supplement that's been used for over 25 years with excellent results and has over 85 published studies on it. And this is the modified citrus pectin developed by Dr. Isaac Elias back in 1995 and has been used clinically since then and extensively researched. And it's so fascinating because the PectaSol, we, as a company, we're not involved in most of the studies that are coming out now on PectaSol. We only hear about them from Google Scholar Alerts. Check the study, it's modified citrus pectin in XYZ area, and get the full text and materials and methods, PectaSol C by Econogenics. So it's so fascinating to see that third-party scientists all around the world are buying our PectaSol from, our website and studying it, and we have no involvement. They're publishing on the results because it is the most researched and well-known galectin-3 inhibitor available.
So not all modified citrus pectin is created equal. Ruby, can you speak to that? I just want to make sure that, I heard you say that even the researchers are using PectaSol because it's the most researched, and I think that's going to inspire our listeners also to know which one to get. But if you can give some more details on this, how are they not equal? How are they not the same?
So PectaSol is the original modified citrus pectin developed in 1995, and it's made with a proprietary modification process that uses some enzymes and heat to reduce the size of the pectin molecules so that they can absorb into the bloodstream. So as you'll see, regular unmodified pectin, which is what the PectaSol is made from, that has a very large molecular size. It's not absorbed from the small intestine. It stays in the GI tract. That's about a 100 to 300 kilodalton range. That's the size of the molecule. PectaSol modified citrus pectin has a very small size molecule, which is less than 15 kilodaltons. So that difference from like 1 to 300 kilodaltons down to 15 kilodaltons or less is what allows the PectaSol to get into the bloodstream and what gives it such bioactivity against the galectin-3. So other citrus pectins may be calling themselves modified citrus pectin because they've somehow treated the citrus pectin. They've perhaps modified it with chemicals, which we've seen, leaving solvent residues and other ways to treat it or modify it. It's not a carefully defined term. So there is, in fact, one study that was published on a modified citrus pectin and shown no effect against galectin-3 in a certain condition. It was an animal study. We got the study paper, found out that the materials that they used were not PectaSol. It was an inferior competitor, modified citrus pectin, and we had it tested, and it does not have the correct molecular specifications. And so, of course, it's not going to show efficacy. And Dr. Elias did publish, and the editors published a letter to the editor explaining that that study was not clear in differentiating the truly effective modified citrus pectin. Not all modified citrus pectin is created equal. So only PectaSol has the published research, and all of the 85 plus studies on modified citrus pectin are done on PectaSol. And that's a really important distinction because there's a lot of kind of copycats out there, or people just borrowing the research and trying to say that this is also going to give the same effects as what PectaSol has shown in the published literature, including clinical studies in oncology. So really important to remember that when you're searching for modified citrus pectin, only PectaSol has been studied and shown to be effective. And that's because it has a very specific modification process that allows it to absorb and work against galectin-3. So we talked a little bit about the differences, but unmodified citrus pectin, such as what you'd find in jams and jellies, that's a great digestive supplement, but it just stays in the GI tract, and the PectaSol's absorbing into the circulation.
So Ruby, it's absorbing into circulation, meaning I know that affects the blood-brain barrier in a positive way. Can you talk a little bit more about that?
Sure. Yeah. So PectaSol has a study showing that by binding to galectin-3, it's actually protecting the blood-brain barrier and strengthening the blood-brain barrier against invasion from pathogens. So we talked about the MMP-9 marker, and that study specifically showed that PectaSol by binding to Galectin-3, reduce the MMP-9 activation, reduce that permeability of the blood-brain barrier, and help to really strengthen the blood-brain barrier in that regard.
It's
So
not going straight to the blood-brain barrier, crossing the blood-brain barrier. It's affecting the galectin. It's binding the galectin-3, preventing it from affecting the blood-brain barrier. Is that what
correct.
you're?
Yes, and it's supporting the healthy microglial responses because the microglial, when they're activated, microglia can release galectin-3. So it really does help by kind of tamping down that neuroinflammation response as well. But it's not entering into the blood, I mean, crossing the blood-brain barrier and entering into the brain, if that makes sense. Because we do get that question a lot because the PectaSol helps to bind and remove heavy metals. So people want to know, can it take the heavy metals out of the brain? And we haven't shown that it's crossing into the brain yet. We may be able to show that in the future.
Right. Now, a lot of our patients, or my patients, are very, very sensitive. They've got mast cell activation syndrome. They really can't tolerate too much. I found that PectaSol, with about almost 90% of my patients, and 100% of my patients are sensitive, right off the bat, 90% of them can take it, and they can take it at full dose, and it's not a problem. Whereas with other binders, there is a problem. Maybe they get constipated, or they actually feel sicker. So with other binders, why is it? What is it that makes PectaSol more gentle? Why
Yeah,
is
so it's a great question, doctor. So PectaSol, modified citrus pectin, is a very unique binder. And we say it's a binder, but it's much more than just a binder. Because yes, it is binding to toxins, to heavy metals. We believe mycotoxins. We've seen a lot of anecdote and preliminary evidence there, and other toxins, and getting those out of the bloodstream. But it's by tamping down that galectin-3, and by also binding and deactivating galectin-3, it's really helping with that inflammatory reaction, that detox crisis that so many people get, which is often related to the Herxheimer or just the inflammation, because binders can move things around, right? So we know that they pull things and they can move things around and they can kind of stir things up. But by binding to the toxins and binding and addressing galectin-3, PectaSol is working, also in the bloodstream, which is semi-unique for a binder. A lot of binders are remaining in the gut. So it's doing so much more than just grabbing toxins to move them out. It's modulating the immune system. It's helping to limit the Herxheimer reaction, stabilize the mast cells, regulate the inflammatory signals. We've shown TGF-beta, CRP, interleukin-6, and other cytokines. It's gently breaking up the biofilms, but it's also helping to mop up some of those biofilm byproducts. And we use it in conjunction with another more broad spectrum binder I'll talk about in a moment, as part of our detox rescue kit. So it's doing so much more than just pulling toxins and moving them around and hopefully moving them out without redistribution, which is what other binders do. It's tightly binding to those toxins. They're not getting redistributed, but it's also reducing that inflammatory overreaction.
Thank you.
Absolutely. And then another interesting thing about it is they call it the Great Program Enhancer because it enhances the efficacy of other approaches. And we've seen this with conventional drug compounds, from chemotherapy drugs to antibiotics. We've seen it with other supplements, with other herbal therapies. We've seen it with other detox programs. So people that were having a really hard time with detox, with their regular detox program, added in the PectaSol and smoothed things out significantly. So it's an amazing product on its own, but it's also an excellent way to enhance the effects of other treatments, other protocols, other supplements that you may be taking. And the idea is that by clearing out those lattice formations and breaking up those intense galectin-3 fibrotic structures, it's allowing these other compounds and drugs to get to their target tissues, get where they're supposed to go in the body.
Thank you.
Absolutely. So this is just a little bit about how PectaSol binds and blocks galectin-3. It's essentially, this is the modified citrus pectin chain, and it's kind of going in here and kicking out these other ligands that are attaching to the galectin-3 and allowing these lattice formations or these, inflammatory signals. It's kicking them out, it's binding it up and deactivating essentially. And it's because the N terminal of the galectin-3 fits like a key in a lock to this modified citrus pectin molecule, or rather vice versa. Oops. Sorry. Can you still see my screen?
Mm-hmm.
So yeah, we talked about it being much more than a binder. And it's just an essential, in my opinion, and from what we've seen, it's so essential with anybody that is struggling with detox because it's such a gentle but powerful detoxifier that's also helping to reduce that reactivity to environmental toxins.
Great. Ruby, we have so many questions. Is this a good time to take
Sure,
them?
yeah. Let's go ahead and take
Okay.
some questions, and then I'll get into one of the formulas that we use often in conjunction with it.
Okay, sounds good. Now, some people have asked questions about their particular diagnoses, their particular health concerns. We can't give an answer about anyone in particular because we need to really understand your health in order to answer that question. So I'm not going to be asking those questions. I'm going to be addressing the ones that are more broad. Okay. Someone's asking, what is the dosage of PectaSol one should take? And someone else asked, what's a good starting dose for sensitive people? So maybe, Ruby, if you could help answer that, what dose would you start for sensitive and for non-sensitive people?
Sure, absolutely. So for sensitive people, you can start with a quarter of the low dose. So the low dose is 5 grams. That's like the basic daily maintenance dose, going up to 15 grams. So if you're taking a powder, that's 1 scoop for the 5 grams, 3 scoops for 15. If it's capsules, it's 6 capsules for 5 grams. But if you're very sensitive, start with a quarter of that dose. So start with a quarter of a scoop, or, just 1 capsule. And if you're super sensitive, if you're somebody that cannot take anything, then maybe even start with just a few sprinkles. And that's what some of the mast cell physicians do with their very, very sensitive patients, just to help sensitize them to start, and then slowly build up that dose based on how you feel. So if you're very sensitive, a quarter of the dose. If you're extremely sensitive, the most sensitive, a few sprinkles, like a couple grains. And it may seem like crazy, like what's that going to do? But it'll help sensitize you to it, and you can start to ramp up your dose slowly that way. Now,
Absolutely. Some of my super sensitive patients, they can actually feel, I tell them just do a toothpick dip, and that it does something for them. They actually feel better.
yeah, it's so remarkable. And then so the optimal high dose is 15 grams a day, and that's for people that either aren't getting results from that 5 or up to 10 grams, and you want to go up to 15, or if somebody's struggling with, needing oncological nutritional support or something that they're really struggling to solve, or looking for that high therapeutic dose. So that would be that 15 grams a day.
Now, someone's asking about if it's safe to use it to help the body heal when you're still exposed to mold. I'm going to answer this question. It's not that it's unsafe to use when you're in mold. I tell my patients, when you're still in the moldy environment, anything I give you is just chasing after the diagnosis. I can't get you back to optimal health if you're still living in a moldy environment and you're affected by it. But I will say that when I've given my patients PectaSol while they're still in the moldy environment, it does seem to at least stabilize them at the sick place they stay. I'm not going to say anything heals anything when someone is still in a toxic environment, but it can help us at least chase it a little.
Yeah, absolutely. And that's what we see all the time. And again, to reiterate your point, we never want to advise people to stay in a moldy or an unhealthy environment where there are those triggers, but sometimes they can't help it, or whatever the circumstances may be. And this can be a way, kind of a bridge, because, the whole remediation process can take a long time as well, and can be kind of a big, huge life change that isn't going to happen overnight. So as a bridge to help people, start to feel better and get that energy so they can make those big changes.
Mm-hmm. And so someone has what I think is an important question for cancer patients. They're saying, are you supposed to take it while on chemo? or can you take these together with chemo, and for how long?
So this is something you definitely want to talk with your physician about, and ideally a physician such as Dr. Parpia, who's experienced in these areas of integration, because yeah, it's as somebody from Econogenics, we're not going to advise to go against what your doctor's saying, obviously. And a lot of doctors are resistant to any sort of natural therapy with chemotherapy. However, there's data showing an extensive clinical use with PectaSol and other chemotherapy drugs and showing synergistic enhancement and, benefits all throughout that oncological support journey. So there's quite a bit of anecdotal as well as published data in that regard. But again, just to reiterate, the importance of working with a specialist who knows the specifics of your case, who has experience in this area, is invaluable, and can't stress that enough. Dr. Parpia, anything that you want to add?
No, we'll go to the next one. So someone is saying, I'm doing an herbal antibiotic with biofilm defense for 6 weeks, and I take this at the same time. So I'll answer this one. So anytime I have my patients working on killing off chronic infections, not one of them isn't on PectaSol. I'm always using it to bind the inflammatory cytokines, the Galectin-3, the biotoxins and neurotoxins, all of these things that get unleashed when we're treating these chronic infections. It's very rare that I'll have a patient not on PectaSol for that support during infection killing. So yes, do take it, but not at the exact same time. I tell my patients, you want to take it about 1 hour away, 1 to 2 hours away from your other supplements and from food, or else it will bind these things. Ruby, do you have anything else to add to that?
We do find that taking PectaSol with other binders can be beneficial and still provide some support. But definitely, if you're taking other prescription medications or specific kill agents that you really want to get, all the way absorbed, same thing with the PectaSol, taking them at separate times of the day can be beneficial.
Okay. Someone is asking about, can you combine PectaSol with augmented NAC to rid the body of spike protein? I like augmented NAC. Okay.
Yeah, I'm not super familiar with augmented NAC. I have heard NAC being really beneficial. Do you want to share a bit about augmented NAC, doctor? I haven't heard of that specific form.
Yeah, this
Heard a
is
lot
a
about it.
form that was created in Italy, and it is, they say that it removes spike protein. I haven't, I don't know if there's research on it. I need to look that up. Maybe there's research on it if it actually removes spike protein, but they say it does, and doctors say that they've noticed people feel better who have long COVID that take the augmented NAC. So it might just be clinical evidence as opposed to research evidence around that. But as for people who have long COVID, if I'm having them taking augmented NAC, I'm also having them take PectaSol and many other things depending on what that patient needs. It's going to be different for each patient. And we don't know for sure if these things remove a spike protein, because I don't think there are studies on it, but we can say we've seen our patients become better. The doctors who use these things, who treat patients with long COVID.
Absolutely. Yeah, we hear a lot of anecdotal reports from physicians as well working with the PectaSol.
Let's see. Okay, someone is asking, they would like to understand when you would recommend the PectaClear over just MCP.
That's a great question. So PectaClear is our PectaSol plus sodium alginates. And it's a great binding formula for heavy metals. We have some published clinical data there, as well as published clinical case study in removing radioactive uranium from a family that was exposed in the Southwest through drinking water. And so PectaClear is recommended when there's high heavy metal burden. Now, we have another binding formula that I'm going to talk about in just a moment that also contains alginates, but it has several other more broad spectrum binders as well. It's a newer formula called GlyphoDetox. And so that one has kind of taken place of PectaClear for our main gut binding formula, but PectaClear is excellent if somebody is very sensitive to binders and can't take the GlyphoDetox because it has other regular citrus pectin, it has some kelp and other things in it. Some people are too sensitive. It is a strong gut binder. So that's where PectaClear would be really indicated. Or if there's just a heavy metal body burden that they're trying to bring down, PectaClear is an excellent formula for that. And the alginates, the goal of the alginates with the PectaSol is the alginates will remain in the digestive tract, prevent that toxin reabsorption and help to detox the gut. And then the PectaSol enters the bloodstream, and both can be used together, PectaSol and PectaClear, to give that, a higher dose of PectaSol if you need that extra Galectin-3 support.
Great. Now, Ruby, can you tell us about GlyphoDetox? I think now's the time.
Great. Yeah, let me share a couple slides. So GlyphoDetox is a formula that Dr. Elias developed several years ago in response to the glyphosate, the data coming out against glyphosate showing its involvement in so many different conditions. And so the intention of the formula is to bind up glyphosate and other pesticides, as well as a broader range of agricultural, bio, and environmental toxins. So like I said, it's a bit similar to the PectaClear formula because it contains alginates, but it also contains kelp and regular unmodified citrus pectin that stays in the gut. So we talked about those size differences earlier, and this is regular citrus pectin, not PectaSol modified citrus pectin. It's a large molecule citrus pectin that stays in the digestive tract and really helps to bind up toxins there. And these are also great ingredients to help support gut wall integrity, and so to help rebuild the mucosal barrier, to help reduce leaky gut, meanwhile binding to those toxins. And they have mild anti-biofilm activity as well. Alginate has some data showing a bit of anti-biofilm activity, so not as strong as what you would get with, say, the enzymes, interphase and others, but definitely some mild anti-biofilm activity there. And then it also contains fulvic acid, which is an amazing humic acid substance that helps to detoxify glyphosate, mycotoxins, and other toxins. Also supports neurological health and immunity, many different benefits there. And then glycine, which is a really interesting and important one that competes with glyphosate at storage receptors in the body. And so what happens when we consume glyphosate, or foods rather laden with it, or we get exposed through the environment, the body mistakes glyphosate for glycine and stores the glyphosate in protein synthesis and can store it in bones, etc. So by giving glycine, we're helping to replenish the body's supply, so it's not accidentally taking in the glyphosate instead. It has enough glycine, so those receptors, those doors are closed essentially. And we recommend this formula alongside PectaSol because the ingredients primarily stay in the gut, whereas PectaSol, modified citrus pectin, will absorb into the bloodstream. So you're getting a much broader coverage of toxins, detoxing out of the circulation, the bloodstream with the PectaSol, and then out of the gut with the GlyphoDetox. And the two really work synergistically and really well together to help to tamp down detox reactions, because the GlyphoDetox binders are very gentle but very effective. They're not strong stripping binders like charcoal, for example, that can really just, charcoal can have its benefits, in acute situations, but not as a long-term solution in, many different opinions. There's different problems with the possible carcinogenicity, cancer agents of it, and that kind of thing with charcoal. And similarly with clays and things like that, they can be effective in the short term, but they're really harsh and they can really strip and move things around and cause a lot of symptoms in people. So these are very gentle, natural binders that also support gut wall integrity, that also support neurological health in these other areas. So we do have it included in our detox reset, or you can get it as a detox rescue bundle on the Econogenics site with PectaSol modified citrus pectin plus GlyphoDetox. And we're finding anecdotally incredible reports against mycotoxin levels, other environmental toxins, pesticides. And one thing to note about GlyphoDetox is we have some really strong pre-published case data with humans showing that GlyphoDetox reduced glyphosate levels in the body with 4 capsules twice a day over a period of 6 weeks. And that's huge because there's no other agents that are shown to reduce glyphosate, there's all kinds of controversy. Oh, glyphosate doesn't get stored in the body, or you can't detoxify it. You'll hear all kinds of different things, but we've shown, and we're currently collecting additional case report data to hopefully publish on this, but that this formula actually does help to reduce glyphosate levels. And so it's giving so much more support for a healthy, gentle detox process by supporting gut wall integrity, reducing leaky gut, microbiome support. A lot of these GlyphoDetox ingredients have prebiotic activity, the pectin, the kelp, the alginates especially. One thing I will note, and I think I mentioned it a little bit earlier, is if you are sensitive to kelp, then this wouldn't be the formula for you because it does have iodine in it. It has the natural, raw, organic Icelandic kelp that does contain 325 micrograms of iodine per dose. So for anybody that's watching their iodine and that's too high of a level, we would recommend the PectaClear instead, which does not have the iodine in it.
A lot of patients are low in iodine and don't know it too, though. So in
True.
that case, it would be great. Yeah.
Absolutely. And it's a low dose compared to what's considered like a daily recommended daily allowance. But again, for some people, that is still too high. So something to watch out for there.
Great.
And then, yeah, we're actually going to be doing a live summer detox reset with these products as the core. We have a core kit and then an advanced kit, but it's very exciting. This is doctor-led with Dr. Lauren Tessier. I know she works with Gordon Medical, doing research, and she's an amazing educator and has some webinars, some educational webinars to go along with it. We'll be doing live Q&A sessions with myself and a lot of very detailed guidance on, diet, home activities to do to really support the detox process. So it's a live event that you're joining with a group of people, and it's a fun community. So this is our second one that we've done this year, and I'm very excited for it.
Super exciting. I think it's time to go back to some questions, Ruby, unless there's anything else you want to tell them before I open that up.
No, absolutely. Yeah.
Okay. Someone's asking, is PectaSol the only way to reduce Galectin-3?
There are some other, like I mentioned, there are some Galectin-3 inhibitors that are currently in development. Those are not yet commercially available. Those are pharmaceutical agents. There's also some research on some other natural herbs, but it's very mild anti-Galectin-3 effects and not a lot of data in that area. But curcumin is one example where they've shown some mild anti-Galectin-3 activity. And then what's really interesting is there's data showing that meditation and stress relief can bring down inflammatory markers, including Galectin-3. And they've shown similarly that under stress, Galectin-3 levels will go up fairly quickly. But over time, as you practice relaxation exercises, and it doesn't have to be meditation, it can be listening to music they've shown or other relaxation-inducing exercises, can bring down those Galectin-3 levels within minutes from being high to a more relaxed level. And the longer you practice those practices, those stress relieving practices, the quicker your Galectin-3 levels will go down when you start to practice. So you started meditating, for example, and your Galectin-3 levels this week may be just going down a little bit. After 6 weeks, you start meditating and they'll go down much faster within this few minutes. So it's exciting data to show that even with practice and over time, those methods can even have an even greater impact on inflammation and especially Galectin-3.
Okay, and now someone is asking about electromagnetic sensitivity. A lot of our patients have sensitivity to this. And the question is, does this also relate to the environmental illness of EMS? Do these people have elevated Galectin-3? And the very interesting part of this, I think, is that do the blockers basically will PectaSol reduce EMF sensitivity?
It's an excellent question. I don't think that there's published data in this population of EMF sensitive people. And again, it's a growing population. We know that more and more people are showing clinical signs and symptoms of extreme sensitivity to EMFs. To my knowledge, there hasn't been any clinical data or studies done yet showing Galectin-3 involvement. But I will say that patients who take PectaSol have reported reduced sensitivity to EMFs. Doctor, any insights there from your practice?
I would say that patients would report decreases in EMF. With my patients, these are my patients specifically who are highly, highly sensitive. There are many more other things I have to do with them, right? I can't say that just one thing will decrease that sensitivity. There's a lot, but PectaSol has been an integral part of my detox protocols for my patients, which then leads to a decrease in EMF. Maybe for people who are not as sensitive, maybe you just give them PectaSol, and that does make a drastic change because you're decreasing the Galectin-3, which is the spearhead of the whole inflammatory cytokine cascade. So when you decrease that, the patient will be less susceptible to inflammation. So it makes sense to me.
Absolutely. And there
Yeah.
is research in regular pectin and radioactivity. And, that's kind of where some of the original pectin research was done in Chernobyl. And I know it's a different form of radiation, but there is data showing that pectin can be a way to address radiation in the body.
Yeah. And someone is saying, so by blocking Galectin-3, we minimize our response, but how does this help with detoxifying the body? So my answer to that would be, when we're blocking the Galectin-3, it's one way of pressing on that inflammatory cytokine pathway, right? So we're slowing down the inflammation, and that makes the detoxification protocols that I bring in a lot easier to do. But the beauty about PectaSol is not only is it blocking the Galectin-3, but it is working on detoxifying at the same time. And I don't know of another binder that has that double quality to it. So it's helping with detox, but there's a lot more detox we need to do if it allows the rest of the detox process to happen in a way that's going to prevent Herxheimer's, in my experience.
Exactly. And also, just to add to that, by breaking up those Galectin-3 lattice formations, by binding to those external ligands and breaking up those pentamers, it's actually, the PectaSol is actually also sort of clearing the path for these other detox agents, these other, whatever else you're taking, essentially, to work better, to get to where it's supposed to go. So in that regard, it can help as well, just by clearing out the system, kind of clearing these hyperviscous structures and these microenvironments that have these pockets of where things are festering, essentially.
Yeah. So, technically we have 3 more minutes left, but I'm available to stay till 1:35 Pacific time. Ruby, are you able to stay
Yeah.
for
Yep,
5
I
minutes?
have extra time. No
Yeah.
problem.
There's so many people who want a lively discussion here. I mean, it's really great. So many really good questions, so many people interested. It's making me really happy. Okay. Someone is asking what to do when PectaSol raises blood potassium to over range. I've never seen PectaSol raise blood potassium levels, and I'm checking my patient's blood work regularly, like every 3 months usually, and they're on PectaSol long term. I haven't seen it happen. Ruby, can you speak to this? Does it raise
We
potassium?
haven't seen this or heard of it, but I will say that if somebody has acute kidney failure or kidney disease and their eGFR is 40 or below, that would be a reason to not take PectaSol because of the sodium and potassium, or a reason to heavily monitor it, I should say, with your doctor. So something to just consider there. But in general, no, we haven't seen the blood levels, going up or heard of those issues, but it may be that patients who are on heavily restricted diets like that just are not taking it in the first place.
Someone is asking about ochratoxin A. We know it's difficult to clear, and they're asking if we have experience with PectaSol. So in my patients who have ochratoxin, I'm certainly using PectaSol, and I'm certainly watching that come down on the labs. I'm also watching them feel better as we remove that mycotoxin. And really, I've seen it work to remove all mycotoxins. Sometimes I'm adding cholestyramine if the mycotoxin loads are through the roof, or other binders. People like to use chlorella. I'm mentioning chlorella because somebody else asked about chlorella here, and can you use chlorella also to remove Galectin-3? I know that people like to use chlorella or think it'll bind everything. Chlorella is very good at binding microplastics. There's no research on it binding galectin-3. I'm really using PectaSol for that. Ruby, do you know anything about galectin-3 and chlorella binding?
No, I haven't seen any data along those lines with chlorella specifically.
Okay. Someone is asking, is there a downside to taking PectaSol long term?
No, this is a very safe daily supplement that, I've talked to from starting with Dr. Elias, over 20 years ago. People are still continuing to say, like, they're still taking PectaSol to this day and attributing their, great health at, older ages to their daily use of PectaSol. Absolutely.
Yeah, me too. Ruby, someone is asking about purchasing PectaSol from Amazon. Tell us what you think.
Well, Econogenics does have an Amazon store, but there are other third-party sellers that we're actively, keeping an eye on, and we don't have control over them. So that's just one area to be aware of. That Amazon is kind of the Wild West in terms of the marketplace. So there are other people selling PectaSol, and we don't have a lot of. We're working to sort of monitor them and get a better sense of like if that is actually what they're selling. So far, we haven't heard any reports of adulterated product or anything that's, counterfeit, but it can be purchased on Amazon, and Econogenics again does have a store there. And it's a great place to read some of the reviews on PectaSol as well.
Someone is asking, do we need to stop drinking electrolyte water when taking PectaSol?
Nope, there's no reason to stop, taking any of your regular supplements. But again, if it's a prescription medication, just at a separate time of day. And then if you're taking any sort of antimicrobials, you want to do those separately as well. But again, it's the great program enhancer. So it can really be used regardless of whatever protocol or program you're doing.
I've got a doctor here asking, can we clarify taking PectaSol with other supplements, not prescriptions, but rather patients taking nutraceuticals like NAC, glutathione? So I do certainly have my patients taking PectaSol in a protocol on the same day as, say, taking glutathione or NAC or other supplements, whatever it is that that patient needs. Bottom line, most of my patients are taking, any patients who are listening, they're nodding. Mine, yes, they're all on PectaSol, right? It's one of the foundational things I give for everybody. I consider it that foundational, meaning important for almost everybody. Do I have them take it at the exact same time? No, because the PectaSol will act as a binder and bind the other nutraceuticals or medications or food, right? Minerals in the food. So I want them to take it on an empty stomach. So 1.5 hours away really is what I like from the other supplements, to be on the safe side.
And we do recommend or say it's okay to take PectaSol with the GlyphoDetox at the same time as the other binders. So it can work because the PectaSol, the other binders typically will remain in the gut and the PectaSol will absorb into the circulation. And that's the basis of our PectaClear formula as well, with just the alginates and the PectaSol.
Someone is asking, can it be taken while pregnant?
We don't recommend taking it while pregnant or breastfeeding just because that is a very sensitive population. We don't have the data. So that's just a very careful group that, we don't have data there. So that's just kind of across the board with any of the supplements that we have.
So I have there's two people here asking the same thing. So I'm gonna answer it really quickly. And it's about the relationship between galectin-3 and Lyme and co-infections. So how am I going to answer this quickly? Galectin-3, as we know, it's going to increase inflammation. In fact, it's going to stimulate inflammation. It's the master stimulatory molecule of the inflammatory cascade, right? And we know that when we have more inflammation in our bodies that our immune system creates, that makes us more of a host to the chronic infections that we have. In fact, that's how long haul, that's one of the ways in which long haul COVID also acts, right? That spike protein is going to act similarly to the galectin to stimulate inflammation in our bodies. And then what have we seen happen in long COVID? infections that were dormant, infections that were asleep, like Lyme, co-infections, Epstein-Barr virus, mycoplasma. Those infections wake up. They stop being dormant. They become active. So I would say it's the same thing with galectin-3. It's stimulating inflammation, and that is going to then cause dormant bugs to wake up. And I see that in my patients, and that's another reason why I have my patients taking PectaSol as foundational support as I'm working on the multitude of infections they have. Chronic, I'm not talking about acute, but it'll help in acute as well.
And one thing to add to that too is that galectin-3 can be hijacked by these pathogens, by Lyme, and used. The pathogens will use the galectin-3 to shield themselves from the immune system. So it's almost like this this great irony that our body's producing this molecule that's supposed to fight infections, when those infectious agents actually take that and start shielding themselves with it, and it reduces T cell surveillance, and it forms the biofilms. So it's fascinating that it can be hijacked in this way, and cancer can do the same thing, can start using it to feed itself, to shield itself from the immune system, to build those microenvironments. So,
and that ties right into Dr. Elias's survival paradox, right? The very thing that we need to protect ourselves, that then too much of it becomes the Achilles heel. And a lot of people ask about the cell danger response. That's a huge, huge topic. It's why I didn't answer your questions on it right now. But in general, it's very similar in that it's too much inflammation. It's inflammation. We need inflammation in our bodies. We need galectin-3 in our bodies. We need both of that to be transient, right? And so that's how it ties into the cell danger response. That's my quick answer for those questions. Yeah. I think we're done. Ruby, is there anything else you want to say?
I just want to conclude with reminding, because we do get this question a lot, is but taking PectaSol, is that going to stop the body's normal healthy inflammation response by blocking galectin-3? And the answer is no, because it's when the galectin-3 is really high in the circulation that it's causing problems. And that's where PectaSol is working. When galectin-3 is inside the cell and doing what it's supposed to do, the body should be functioning normally. You should have that normal inflammation response, begin and then end, but there's no evidence or anecdotal data or anything to suggest that PectaSol is in any way going to interfere with the natural immune response and inflammatory response. And in fact, it can really promote it and optimize it. So just want to clarify that.
Thank you, Ruby. Is there anything else you want to say about the program, the Detox Reset program?
Yeah, the Detox Reset program will kick off on July 15th. So if you're interested in joining, we definitely recommend getting your supplies ahead of time, and then you'll get plugged into our email system, and you'll be getting those daily reminders, and you'll be able to join our live Q&A sessions and watch all the videos. So you'll have access to the whole hub of resources, and it's just an excellent program. We had an amazing time when we did the last one in January, excellent feedback, and it's just a wonderful way to get some extra support during the detox process, because as we all know, that can be helpful anytime. So.
Great. Thank you so much, Ruby. You're a wealth of knowledge. And I know everybody just enjoyed this. I sure did. So thank you.
Thank you so much, Doctor. It's been wonderful. Hope to talk again soon.